Happy Friday, everybody, and welcome to everyone's favorite show about plastic surgery, health, and beauty. This is Nip Talk. We got a very special episode today because it's all about young people, teens, Gen Z. First off, Gen Z's views on plastic surgery. What are they? I bet you're going to be surprised when you hear. Next, what's good skincare regimen for teens? And finally, social media, beauty standards, and teens. How do these all relate? We're going to discuss that, and it's coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk, an honest and uncensored show about plastic surgery, health, beauty, and lifestyle, with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you guys so much for joining us. We really do appreciate it. Please hit that like and subscribe button. It helps us so much. I am your host, plastic surgeon Dr. Bruce Hermann. With me today is not Sarah. Unfortunately, Sarah has the flu and is sick at home. We wish her well, but my daughter Danica is standing in for Sarah today, which I think is great because we're going to be talking about young people topics. Yeah. So, also as always in the box, we got Travis. How you doing, buddy?
Yo, how's it going?
Very good. You having a good Friday?
Yes, I am having a really good Friday.
On.
And now we got Big Herman and we have Little Herman on the show. I like it.
Yeah.
I like it.
Well, she's not a stranger to the studio. She does come up here quite a bit, and I know you were on Jeff's show a little while ago. How was that? Did you enjoy it?
Yeah, it was super fun. I mean, I was a little nervous at first, but just as it started going, I just kind of got into the flow, and it got a lot better.
Like when it first starts, you're just kind of like butterflies.
Yeah, you're just kind of tense.
Right, but then you just realize it's just having a conversation, just like anything else. Yeah, I thought you did really, really good on that. And,
well, thanks.
And also, I know you have a lot of social media. You want to share what you're doing these days on social media?
Well, on social media, I mostly just do video games, and I also do anime stuff, edits, all that. Just my life.
I told Travis, I think, at some point about how you build up this huge social media account, and then they figured out that you were too young to be live streaming, and they they banned you.
It was really sad.
Yeah, I remember that.
That's the way the game goes.
I know. Well, pretty soon she'll be old enough she can be legit.
Absolutely.
But no, I've been very impressed with your ability to. Well, just to be on camera, I mean, you're kind of a natural at it. You do very good. So
thanks.
Yeah.
You too.
Oh, well, thanks. Well, we're going to jump into our segments today, and I'm so glad you're here because I thought since you're going to be here, we're going to talk about some topics that concern teens because you are a teen, right?
Yes.
How old are you? 18 now?
13.
Oh, 13. Okay. Talk about teens, Gen Z, and those sort of things. So the first one I want to start talking about is Gen Z's view on plastic surgery. Now, for those who don't know, Gen Z is people born in the years roughly 1997 to 2012. So you're kind of at the tail end of it. That's totally fine.
Yeah.
So there are definitely some people in Gen Z that are a little bit older than you. And so I'm going to have some questions for you, but I'm just going to lay some groundwork here. So,
all right.
So we've seen a big boom in both plastic surgery and aesthetic procedures since the pandemic. That's been well established. But what's been really interesting is that certain groups have seen bigger increases in interest in these things, and Gen Z is actually the one with kind of the biggest increase of people looking for whether it be surgery or cosmetic type procedures. And a lot of people found that to be a little surprising because Gen Z kind of has this reputation of really accepting and
be you.
Be you, right. And so maybe it's a little surprising to learn that Gen Z really has actually kind of been characterized as the generation most open to plastic surgery.
Really?
Would you have thought that, being
Honestly,
a young person?
I wouldn't have thought just because in Gen Z, it's just a lot of your body's beautiful and no matter what.
Right.
So seeing people seeing that Gen Z is the most known thing for
most
plastic.
interested,
in plastic surgery.
Yeah.
It just seems kind of odd because not saying it's hypocritical, but
I will say that I have seen this personally. I mean, you see these articles that say this, and I have seen it in my practice that we get a lot of really younger people in the office these days. So I would kind of agree with that. And so the question kind of pops up of, okay, well, well, why is this? And I have an idea. What do you think?
Um,
Why do you think that like Gen Z might really be interested in like looking their best?
Well, cause like social media is like
Boom. That's all you gotta say. It's like social media. I think that. I mean, what do you think, Charles? Do you think social media play a big part in this?
Yeah, absolutely.
Yeah.
I think Gen Z, like millennials, they may have like kind of introduced the trend of like social media, you know, like Facebook, MySpace.
No, I'm gonna have to back up a little bit there
wow,
because I
okay,
think
here
it
we
was
go.
actually Gen X that introduced social media. But go ahead. I didn't mean
think so?
I didn't mean
Okay.
to like generation shame.
No,
but go
no,
ahead.
at all. No, not at all. But I think it reached like a really big height with the millennials and
Yeah.
then the Gen Xers. I'm sorry, Gen Zers.
Yeah, they just like exploded.
Yeah,
with it.
Yeah.
they took it to another level.
Yeah.
For
So
sure.
I do agree with that, and we're going to talk a little bit about that in a later segment. And so I was going to talk about like what procedures and treatments they're getting, right? Because obviously Gen Z people aren't coming in and getting facelifts. I mean, that would make no sense.
just-
Yeah. So we're seeing a lot of Gen Z come in to get Botox. Now, that might be a little odd for some people who think that Botox really is for older people who already have wrinkles, right?
yeah. I mean, that's what I think.
Right. And so the reason that Gen Z people are doing it, and this actually is very, very smart, is if you start using these products when you're younger, so say you're 20s. Now I know that's a little older than you, but
Yeah.
but like some of the older Gen Zs are in their 20s, and if you start using products like Botox that prevents you from having wrinkles, like you never get wrinkles.
Really?
Like ever. Yeah, you can basically keep your face wrinkle-free for really your entire life if you wanted, versus somebody who might come in at 50 years old and already has the wrinkles. It's hard to erase them.
Well, I'm set for life with you, so that's good.
Yeah, you're a little young for Botox yet, but one day.
One day.
So Botox is really popular. Another one, and let me see if you agree with this one, is the fill. Are you familiar with fillers? Do you know what a filler
That
is?
makes like your lips bigger, right?
That's one thing it can do, yeah.
All my friends steal my lip plumper all the time. Like,
So let me guess. So you and your friends have like, what is like something that goes on your lips?
yeah,
to plump your
basically,
lips?
I have this lip gloss, and it's like lip plumper, and it has some like, I think it's like allergy thing in it, you know, where it kind of like
Makes your
something-
lips swell?
Yeah, I don't know how to really.
That's really
explain it.
interesting, right? I mean,
It
that
is.
like kids at
That's
her
different.
age, it's like they're almost like they're doing what lip filler does, but without the filler. Yeah.
Yeah,
Because
for
right, you see that on social media, and it's an attractive look if done correctly. There are some bad filler.
Like too much.
Yeah,
is-
too much is not good.
Yeah.
Yeah, you want to be in moderation. The other thing that's really popular with Gen Zs actually is breast surgery. Like breast augmentations are really high in that group, and breast lifts, surprisingly. And I have seen that too in my practice. And then finally, like facial treatments. So like lasers, you like the lasers Mom and I get?
Oh yeah.
Gen Zs actually are really using those a lot. And once again, it's not necessarily about trying to correct issues, but
Preventing them.
But yeah, exactly
Yeah.
right. Preventing them and also bringing out like the best, like getting like that best glow for your skin.
Definitely.
So yeah, it's really kind of interesting when you look at that Gen Z really kind of has embraced plastic surgery and aesthetic treatments, and so as a plastic surgeon, like there's a couple things that I would say about this. I mean, one, you definitely don't want to take it to an extreme at a young age. I
Definitely.
mean, like I think it's totally fine if like 20-year-olds want to get Botox, which sounds crazy, and then 10 years ago that may have been a crazy thought. But I mean, it does help, Surgery, the only thing about getting surgery at that age group is if you're female and you get surgery at that age group and then you have pregnancy, you have kids, it does change your body. So you potentially would have to have a repeat surgery. So in the past, a lot of people would wait till after kids to get plastic surgery. Not always, but sometimes.
I didn't know that.
Yeah, and so that's just something to think about. And I always console my patients on that when they're younger about, hey, just be aware that when you decide to have kids, that pregnancy, can change that. And then things like the facial treatments are great. I mean, anything that's preventative, that's going to prevent your skin from aging, is like a good thing. I
Yeah.
think personally, as long as you're
like-
not like obsessed with it.
It's just like surgery and skincare, like they're pretty similar if you really think about it.
Yeah, the surgery definitely has a little bit more involvement.
Yeah.
There's a little bit more, you have to like think about and
Yeah.
and plan for it. So I wanted to ask you, and I know you did some homework on this, and so I'm not putting you on the spot, but What are your thoughts when you like see, like maybe you're on social media and you see like an influencer saying that, hey, I'm gonna have plastic surgery or I'm gonna have like this cosmetic treatment. Like, what do you, as in your age group, which I know you're Gen Z or you're a little in the younger, like what do you think? Like, what does that mean to you? Anything?
Well, I think like plastic surgery as a whole is, I mean, it's not a good thing, but it's not a bad thing either.
Right, it can be either or.
Yeah,
I would agree with that.
It just matters like what you do, and if you do it in like too much, then it kind of gets weird. But I think if you're just doing it and it makes you happy and makes you more confident, then go for it.
I think that's really good.
That's
actually,
super good advice.
That's a really good answer.
She basically said, do it in moderation.
Right.
And
Yeah,
do it in moderation and
that's really
tip
good.
whatever
And
field that you want.
and I want to say I didn't tell her to say that. I was just going to let her say what she wants. Now I wanted you to ask your friends what they thought, because so Danica's friends come over to the house all the time. They're super cool. I like them all. But I just wondered what their thoughts were. Now, you did ask them, right?
Yeah, I did.
Okay, so do you want to like just say, so this is other Gen Z, younger Gen Zs. What did they say about plastic surgery?
Well, one of my friends named Kaylee said it's fine if it's in like smaller amounts, but too much is just bad. It's fine if it's in smaller amounts, but it can also be kind of bad for your mental health. Just to think that like you have to get surgery to be pretty, which
right, if like you're obsessing about it, which I agree, or if like you have like a body issue, like I agree with that. That's smart. Okay.
Yeah.
What else?
And then my other friend said it's good, just not in dramatic amounts. So a lot of them kind of
smart.
agree.
You have some smart friends, yeah.
Thanks.
Did you guys come up with these answers together?
No, I text them all individually.
Did you? Okay. All right. What else you got?
One of my friends said it's a great way to like boost your confidence, and it can enhance someone's natural beauty because, I mean, everyone's beautiful.
Wow. Okay. Good. Anything else? Or is that about wrapping up?
Some of my friends said this one was a little confusing. It said it can be interestingly morbid and fascinating at the same time.
So they're thinking more about maybe like the actual aspect of the surgery, not necessarily the outcome.
Yeah, that's kind of true.
Yeah. Well, I have to say, like, I am actually impressed with you and your friends' answers. Like, those are actually good answers, right? In moderation, it's okay if it boosts your confidence, but don't take it to extremes. So, yeah, well, I appreciate your insight in that. So I just want to do like a quick recap on this segment. So we're talking about Gen Z and plastic surgery. So there's been this big boom in plastic surgery and treatments and cosmetics since the pandemic. Crazily enough, Gen Z has shown the biggest increase, and I've seen that in my practice. In fact, a lot of people find Gen Z to be the most kind of agreeable or kind of okay with plastic surgery in general. Things that they're doing, Botox really popular, facial treatments, also breast surgery has been very popular. And so I think that's very interesting to see that young people are kind of embracing plastic surgery in moderation. That's kind of a change from other generations in the past, and it's just kind of interesting how this trend will play out. So that's what we're talking about.
Yeah.
All right, very good. All right, well, let's move on to another kind of interesting segment, and I'm very eager to hear your thoughts on this. I know a little bit about your thoughts, but this is a segment about skincare for teens. All right, and you already are using skincare products.
Yes.
Yes. Now, did you start that, or did mom start you on those things?
No, actually, I started on it because I just kind of saw my skin and I was like, I don't want it to be like matte or whatever. I don't want it to get acne, so I'm just gonna try and start young to have better skin in the future.
Now, did you get that from like seeing something on social media, or how did you like even come to think, or were your friends talking about it, or what?
Honestly, it's been a while, so I kind of forgot, but my guess is I probably got it from social media.
From social media.
I get a lot of things from there.
Yeah, from seeing stuff on skincare. Well, I will say that skincare is definitely a lifelong commitment, and that starting early in your teens is not only establishes really good habits, but it also is preventative for stopping your skin from aging and having to kind of chase it later on in life. So. Yeah. You're actually doing a really good thing for your skin. And a lot of people ask, okay, so what's like the right time to start this? And most skincare experts will say that the right time to start skincare is around 12, but most importantly, like by puberty, when hormones start changing, because that's when your skin really starts to change from like the skin of a child, which is usually very fair, to potentially not as good due to oil buildup and those things. So around 12 is a good time to start that. So I wanted to ask you, before I kind of go into this, like what is your what's your skincare routine? Like, what do you personally use? And you don't have to name like specific products unless you want to or you know them, but kind of walk me through what you do with your skin.
What I do with my skin is whenever I shower, I do like a rice like face wash, you know?
Okay, so like a facial cleanser?
Yeah, and then when I am just doing it like on days I don't shower, I just do like some serum drops to make my skin glowy.
So is that serum like a moisturizing serum?
Yeah, kind of.
Perfect. Okay, that's good.
I do some acne drops, just make sure I don't
Now,
get
do you
acne.
do that like all the time, or you do it like if you start to see a breakout?
If I start seeing like red dots on my face, then I'll start doing it.
And do you know what is that? Is that like salicylic acid or benzoin? Do you know? You don't know.
No.
It's okay. A lot of times it's those things will have like a name brand, and so it'll probably be one of those two.
And then another thing I do is I get this like eye cream and I put it under my eyes just to fix any dark circles.
Wow, you have that's a pretty aggressive regimen. Now, how did you learn that from mom, or did you pick this up from your friends?
For like a skincare routine, or?
Yeah, like, well, how did you get into the routine? I assume mom probably showed you, right?
Actually, no. Or she told me to wash my face, so.
Okay, well, that's good.
That, and then with the skincare actual routine, I just kind of got more skincare products over time, and I realized kind of what suited me, like what would make me not break out, what I needed to make my skin like look better. Because I'm not gonna use like acne drops if I don't have acne, but sometimes I do, so I use those just in case.
Yeah, and that's actually something I'm going to talk about. Wow, I'm actually pretty impressed. Yeah. So, kind of to go over like what teen skincare should be is it should be a pretty simple routine. When you look at adults who oftentimes have a lot of like more complex issues with their skin, like their skincare routine can get really kind of crazy because they're trying to go after all these different problems they have. But for teens, you want to keep it simple. And it really kind of boils down to 3 things that you should be doing regularly, and then potentially some occasional things. And you hit 2 of the 3.
Nice.
Yeah, you did pretty good. So cleanser is a big one. So cleanser is just something that you use to clean your skin, to get off makeup, to get off oil, to get off dirt, and keep your skin as clean as possible, because that's the best way to keep your skin healthy. And when you're looking for cleansers, you want to choose one that is either for young people specifically or for sensitive skin. Because a lot of the cleansers for adults have more harsh chemicals in them.
Yeah, I do sensitive skin ones for a while.
Does your skin break out sometimes? Or can it? Have you noticed?
Yeah, I mean, sometimes when I start using like new makeups, like let's say I get a new foundation, I'll notice a little bit of breakout, but I mean, those just go away with time. And
Yeah. So for young people, it is important to use either one for sensitive or specifically young people, because they are more prone to breaking out from the chemicals. So that's something that should be done twice a day. It's best to do it morning and night.
Really?
Yeah.
I only do it at night.
You want to do it morning and night, because overnight you can get oil buildup on your skin.
Oh, that's true.
Yeah. But it's okay. I mean, if you're not doing twice a day, it's not the end of the world. Your skin looks great, so you obviously
Thank
do it something
you.
right. After cleanser would be moisturizer. So, and you said you used a serum.
Yeah.
I'm sure that's a moisturizing serum. You want it to be lightweight with good hydration and something that won't clog pores. So a couple of good ingredients. You probably don't know what ingredients are in your. If you don't, it's okay if you
I
don't.
don't.
A lot of adults don't know what
I
ingredients
was
are in
thinking,
their
and then I just kind of
moisturizer.
forgot.
So the big ones are glycerin and hyaluronic acid. Those are like 2 really common ones. Especially those are good because they're not overly aggressive and cause breakouts. So moisturizer is important. You want to keep your skin hydrated. Hydrated skin is healthy skin.
Yeah.
And the other thing that you didn't mention, although this may be rolled into one of the treatments you're already doing, is using broad spectrum SPF, which is sunblock.
Oh my gosh, I was gonna mention during the summer, sorry, but I was gonna mention I kind of use a sunscreen moisturizer during the summer.
Perfect. Yeah, I was about to say your moisturizer may have the SPF in it, because that's really common for them to roll them in together.
Yeah.
And as you may or may not know, I'm not sure a lot of young people know this. I mean, the sun is really, really bad for your skin. Now,
Yeah, I know that.
That doesn't mean that if you go out into the sun, one day that your skin's gonna, be old the next. But it's a cumulative effect. If you're constantly going out in the sun for years and years, it catches up with you very quickly, and your skin can age much, much more rapidly than if you protect it.
And you can get skin cancer too.
That's another thing, in a totally separate thing, is that yes, you can absolutely get skin cancer. We're more specifically talking about appearance, but yes,
Yeah.
you're 100% correct. So So yeah, that's kind of the basics of skincare for teens. You want to use a cleanser, moisturizer, broad spectrum SPF. If you have more complex issues like rosacea or eczema, which are
Some of my friends have that.
do they? Okay, so
Yeah.
for that you would want to see a dermatologist, and you probably would have to use something separate. So the other regimens just for like the basic teens out there who just want good healthy skin. You definitely want to avoid treatments for what older people would use,
Yeah.
right? Because it's more harsh on your skin and you just don't need it.
Yeah.
And then you want to avoid retinols, which are very popular, except for cases of severe acne if it's by prescription. And then finally, when you were talking about the acne breakouts, the salicylic acid and benzoyl peroxide are the two most popular ones. I bet you're almost certainly that you're the one you use when you have your breakouts has one of those. Those are really popular. So.
Yeah.
But yeah, and do all your friends use? Do they all have their own skincare
Yes.
regimen?
I
Or do you guys compare it?
Oh yeah, I actually asked my group chat, hey, do you guys have any skincare? And then my friend private texted me like her entire routine.
Oh, really?
Yeah.
Oh wow. But is it similar to yours?
It's similar. I mean, different products for different skin, but
Yeah, right.
there's
Which
like a
is smart.
moisturizer, cleanser, like
Yeah.
acne stuff, all that.
Yeah, excellent. Travis, do you have a skincare routine? Or do you have one yourself?
No, I do not.
Yeah.
I have soap and water.
Yeah.
as
Well, I
well.
mean, there's cleanser. I mean, that's like the first step. Yeah.
Yeah, for sure.
I have stuff. I'm not great about using it. But yeah, I mean, it is helpful. I mean, even for people, I mean, you're younger than me, but like even for your age, my age,
Absolutely.
for guys, like it is important. But it's good to
Absolutely.
see that teens are jumping in there and starting early. Like
Yeah,
it
for
will
sure.
pay dividends. So yeah, so just I just want to recap this one real quick. So today we're talking about skincare for teens. Now, skincare for teens should start somewhere around 12, right about the time puberty starts, because that's when hormonal changes will start to change the skin. The big thing about skincare for teens is to keep it simple. You don't want to use these crazy aggressive treatments that older people are using because your skin's more sensitive, it can break out, and you just don't need it. You need a good cleanser to clean your skin, something that is not aggressive, maybe specific or sensitive skin or teens. You want to use that twice a day. You need a good moisturizer, something lightweight that's not going to clog your pores. And then finally, you need good SPF. You want to protect your skin from the sun. That's really important to prevent skin aging as well as skin cancer in the future. For those who get breakouts of acne, you would use those as spot treatments with benzoyl peroxide or salicylic acid. Of course, if you have rosacea or eczema, then you would need some other types of skin treatment, but that would be something prescribed by a doctor. But yeah, for skincare for teens, you want to keep it simple. Remember, cleaning, moisturizer, SPF, most important. So there you go.
Yeah.
All right, thank you, Danica. That was great. I'm very impressed. I know we've never really talked about all those things in a lot of detail, but I have to say that that's impressive. Yeah.
Thank you.
Okay, last segment. I want to get your thoughts on some of these things, and
Okay.
Travis, you too. This is a segment about social media beauty standards and teens/young people. So as we know, social media is integrated into like every part of our lives these days, and especially young people.
Yeah, I'm on it so much.
I use social media a lot. I use it more than I do, and probably we should be restricting your phone because I know you're on there all the time. But no, it's really embraced everyone's lives these days, especially the young people. And so there's been a lot of talk, a lot of research about how social media has been setting beauty standards and how that affects young people.
Oh, yeah.
So we're gonna kind of go over some different points here with that, and I want to kind of get both of you guys' thoughts. So the first is the effects of social media on body image. So I know you're on social media a lot, Danica. Like, based on what you see on social media, like, what do you think is portrayed as ideal body image these days?
Well, an ideal body image on social media, it's kind of unrealistic in my opinion, but
Okay.
like a slimmer waist, like a bigger chest, and like a big booty.
So you
That-
still
yeah.
think that, and it's funny, we talk about this on the show all the time about like what's kind of standard. So that kind of Kardashian look that you're talking about was extremely popular. I feel like that's starting to slide away a little bit, and we're not seeing kind of those exaggerated curves.
Yeah.
But I would agree that. What do you think, Travis? Like, you're on social media a lot. I mean,
So I would agree with Danica when it comes to like body image for the women. For the men, I would say it kind of ranges. But for women, yeah, I would say the same thing. But I do kind of think you are correct. It is trending back towards like the natural way of looking.
I think it is. I mean, it's hard to say because these things move slow, but
right, it is very slow. But
Yeah.
I think people are kind of starting to see like the like toxicity of like BBLs and like that body type.
Yes, people have been watching the show.
Yeah,
Down with the BBLs. Boo.
Absolutely.
All right. The other thing that is always talked about with social media is self-esteem issues. And you said the exact thing that this is talking about. What did you say? What did you say about body images on social media?
It's kind of unrealistic.
Yeah, unrealistic.
Especially for younger girls, like.
Yeah.
Because if you're like 14, you're not gonna have curves mostly.
Right. Well, and also too, you know, where I get kind of concerned is, and I don't worry about you personally because I feel like you really have a good head on your shoulders and you kind of understand things. But like, I worry about young people looking at, you know, like a 25-year-old that may have had either treatments done, surgery done, is using filters, and looking at that person and thinking, okay, this is what I should look like.
Yeah, that's definitely happened to a lot of people, and sometimes including myself, but I'm better about it now.
Is that something your friends talk about at all? Like, you know, what these influencers look like, and you know, I wish I looked like that, or what's the kind of thought process on that?
Well, all my friends and I are like pretty confident, we would like to say. We all think
I would agree with that.
we all like to think that we're pretty in our own ways.
Okay, that's good. So you guys don't get too hung up on how influencers look.
No.
I think that's great, but I'm not sure everyone shares you guys' confidence. And I
Yeah.
think that some people can get into a trap of getting low self-esteem from seeing these unrealistic these unrealistic images on social media.
Yeah.
Next would be social media and behavioral outcomes. So things like taking the perfect selfie. Now, I know you do this. Like, social media has changed the way you don't just take a picture. Like, you gotta like make sure your hair's right. You gotta make sure the lighting's good, that you have the right smile.
The angles.
The angles, yeah. I
The
mean,
angles is
I
important.
do the same thing, man.
Angles is
it's funny
important.
how social media has changed our behavior, and also, you know, how people get their kind of sense of worth based on how many likes or interactions that things, and that's where it gets. I don't mind people like taking time to take a picture. Like, I don't think there's anything wrong with that, unless it becomes like an obsession. But you know, when you get like feeling down, do you ever get down if you? And I know the answer to this question, so we've talked about. Like, if you make a post and it doesn't get a lot of likes, how does that affect you?
It does make me sad, like if I'm doing a live stream and no one joins, but I mean, it doesn't hurt me much. It's just kind of disappointing, you know? It's not like, oh
Yeah.
my gosh, I'm so sad. It's just like,
Yeah.
oh man.
Well, and I have to say, I know I've talked to you about that before, that you have to take social media with a grain of salt. And like, if you throw something up there and it doesn't get a lot of likes, it doesn't mean that it's bad. It just, you know, it just means that for whatever reason that one didn't hit.
Yeah.
You know, and you just got to keep trying. If that's what your goal is to like, you know, gain a following, then you can't
Give up.
You can't give up. You can't take it personally, you know. And so, yeah, but it is kind of funny how it has changed our behavior, which is totally true. Next one, social media and trends. Now, I know you see all these trends on social media, like, and whether it be challenges or like products. Do you ever see these things and want to try them?
Yeah, so actually, Mom and I get like a teen trending box every 3 months, just like with the newest trends in makeup and stuff.
Really?
So, yeah.
And do you get stuff you see on social media?
Yeah, actually, I got my favorite lip plumper, which I was talking about recently.
Oh, right, the lip plumper. Yeah.
Yeah, I got that from that box, and I saw it all over TikTok, and I wanted it so bad, and now I have it.
So you would say that you see these trends, and sometimes you do want to get on board with them.
Yeah.
Yeah.
I do that a lot.
I mean, and that's just life in America. I mean, people see stuff, whether it be TV, social media, and you do want to try it. And I think it's fine, but it has to be done in moderation. Like, you don't want to, you know, make rash decisions. Like, you see somebody that had a surgery, you don't want to rush out and have that surgery.
Yeah, or like especially with hair dye and stuff, because
right, things that are more permanent. Yeah.
Yeah.
Like, I just worry that people, you know, either spend too much money or do something rash that's really dramatic without giving it thought.
Yeah.
That's my only thing. But I see stuff on social media all the time that I want to try. I mean, that's business. What about body modification, tattoos, piercings? Do you think that social media has made those things more kind of mainstream, more acceptable? I mean, do you see a lot of tattoos and body piercings, or maybe your social media feeds don't have that?
Well, my social media feed is mostly like gaming and stuff, but whenever I do, they usually do have piercings. I think social media, well, I don't really have a say just because I wasn't really alive when social media wasn't that
you don't know any
big.
different. Yeah.
Yeah, so I mean,
I do think that it has brought stuff like that. I mean, elf ears, right? I mean, how often we
I was just thinking
I
that.
was
It's
just-
so funny you said that.
yeah, elf ears.
It literally just crossed my mind.
Yeah, I mean, we see these trends on social media, and like it almost normalizes them
Yeah.
when you see
Yeah,
them.
facts.
Yeah, and so I don't know if that's necessarily a bad thing. Finally, what about body positivity? Would you say social media is good for body positivity or bad? What are your
honestly,
thoughts?
it just like matters like what video like gets on someone's For You page. Like, because sometimes I'll see a video of someone and then the comments will all be like, "Go girl, you're so pretty," and then like sometimes I'll see a video and then all the comments will be really mean. It just kind of matters like who's seeing it.
I agree 100%. I think that social media has a very powerful voice to be a good voice for body positivity. And I see a lot of videos that do push that, and I think that's great. But I think you hit the nail on the head. The comments is where people get like brutal. And I hate that, and I firmly believe it's because of the anonymity of the internet. Meaning people will say stuff online they would never say to someone else.
Real.
Right, because it's anonymous. Like, I mean, you know, people would never say these things to someone in real life.
Definitely.
And I think that's kind of a bad thing. I mean, you know, I know I've told you this. Like, you can't take anything said on social media to heart.
No,
Because there's always
don't.
going to be someone that's going to try to tear you down just because they want to get a reaction out of you.
Yeah.
But the thing is, I don't know if everyone knows that, and I think a lot of people do, you know, can get depressed and stuff from the negative.
Yeah. Like my first few years on social media, I was definitely more like critical of myself when I got comments, but now I'm just kind of like, who cares? I'm having fun.
Yeah, and that's the right way to do it. I'm not sure everyone has that attitude, but that's definitely the right way, is to be like, look, I get that people are just going to say stuff no matter what. I'm just going to let it roll off my back and keep going. So.
Yeah.
Facts.
All right. Well,
Facts.
I think that's about all the time we have today. Danica, thank you so much for stepping in for Sarah. I mean,
Real quick too, Dr. Herman.
Yeah.
Danica was getting a lot of love on social media.
was she?
Robert Dreschel, he started hashtag Danica, hashtag boss. Ellen Courtney, she said, Danica, you are a wise young lady. And then it looks like Cindy Herman, she commented as well. She says that Danica is her new favorite co-host.
and
And she
Sarah,
says
she doesn't mean that.
she does still love Sarah. She does still
We
love
do
Sarah.
love Sarah.
But she's a little biased.
But you really, honestly, you did a great job.
Thank
and
you.
I appreciate you coming on. So,
I appreciate you letting
Well, do you
me.
want to do the, I normally do the sign-off. Do you want to do the sign-off today and just tell everybody thanks for watching and
Okay.
come back and see us next week?
Thank you guys for watching. Come back to Nip Tuck next week to see a new episode. Bye.
All right. Bye-bye.